So, as we have already discussed, okay, there are different types of research design in public health. Yes, Ujjwal, can you just elaborate upon which all research, different types of some of the designs we have spoken about? What are the
Yes,
different
sir.
types of research?
Sir, actually, descriptive and analytic research,
Okay,
analytic research, qualitative, quantitative, conceptual, empirical,
okay,
experimental, diagnostic,
okay.
historical, cross-sectional study, and conclusive research.
Very good. So, and when you see any of the researchers in terms of any research study, okay, now
Okay.
here, so there are different types of research study. For example, in clinical medicine, we have got clinical practice guidelines. Okay. So there is
Yes,
a
sir.
topmost because there will be guidelines. Suppose if you have to treat COVID, now what is the standard protocol across the world in which COVID has to be treated? So this is a clinical practice guideline. Now this guideline definitely would have come from different researchers from different parts of the world, and which has gone under scrutinization. It has gone under scrutiny from the different experts, and based on this, a consensus is being built, and it is being seen, okay, this type of patients has to be dealt with in such a manner. Okay, that is basically your clinical practice guidelines. Because in all these cases, we create a pyramid. Now, in a pyramid, there are researches which are at the base of the pyramid, that is, which are most common. So most common are one, they are like an opinion. You can write about your opinion in an editorial study. Okay, you can write your opinion about any concept. Okay, and you can write to the editor. Then there are studies like the case studies. Now under case studies, you have seen certain case and you are trying to describe it. That is also a type of a research. For example, when the first lady saw the COVID case and she wrote about it in the research art, like such a disease is being seen where such and such symptoms are being seen, and we feel like it has to be brought into the notice of the scientific community to discuss more about it in the population. Maybe or may not be, because it might get converted into an epidemic and then further into a pandemic. Okay, or it might be just localized to one population. Okay, is it clear to everyone?
Yes,
Yes,
sir. Yes,
Rajiv.
sir.
Yes, Rajiv, how are you? Yes, is it clear? Okay, and then there are different types of studies, like for example case control study. Then within a case you are trying to have another control group, and where you are basically comparing between the two groups, like in order to see what changes that happens. Suppose you are giving an intervention in one group, and in the other group you are not giving any intervention, or you are just giving a placebo. Okay. Okay, by the way, Shamta, what do you mean by a placebo? Shamta Singh, what is meant by a placebo? Yes, Ujjwal, what is meant by a placebo?
Hello, sir.
Yes, what do you mean by a placebo? Placebo
Sir,
effect.
actually, a substance that has no therapeutic effect used as a control mental satisfaction in our homeopathic opportunities in testing new drugs.
Okay. Okay. So can you give any example of a placebo in public health? In public health?
सर एक्चुअली हम लोगों का ट्रीटमेंट में होम्योपैथिक ट्रीटमेंट में जब कोई पेशेंट को कोई मेडिसिन देना नहीं चाहिए, बट उसको मेंटली सेटिस्फेक्शन माने मेंटली सेटिस्फाइड करने के लिए उसको मेडिसिन तो फॉल्स मेडिसिन की रूप से प्लेसिबो गिविंग टू प्लेसिबो.
ओके, ठीक है. Can you explain the same thing? अगर public health में, if I have to give a same example in public health, where you are dealing at a population level, okay, then what do you think could be an example of placebo? Yes, Dr. Hussain, can you think of some example?
Hello. Yeah. Actually, there may be many things, but it will not be. It will just be a representation, but it will not be actively be the medicine or whatever you may say. It is just a substance which given, and we can think that it is a substance, but it is not. It has no clinical or it has no therapeutic value.
Okay.
For example, we are giving paracetamol in case studies, case control
Okay.
studies, and in control we give some tablets, which is not paracetamol.
Okay.
It is you can say you can glucose tablet, something like that. Which has no effect at all.
Okay.
You can say it is a false. You can say.
Okay. Yes, absolutely. And in terms of in public health, in terms of suppose I am using two programs. Okay. Now, if you have to compare between two programs, suppose I am using a Kala Azar program, and in a Kala Azar program, if I am using cash, like anybody, so for example, in an infant mortality rate. Now, if I want to reduce infant mortality rate in any population, so I want to motivate the community. So in one community, I would say, suppose I am giving you money. So that is an intervention. Okay. And in the other community, what could be work as a placebo? If I want to see if my research topic is the effect of cash-based incentive in preventing infant mortality rate among a certain section of the society. If this is the if this type of research we want to conduct, do you think like cash would have an effect on reducing, if you distribute cash, like if somebody follows an institutional care, or if a person follows an institutional care and reduce the maternal mortality rate in any population, okay, where if you follow an institutional care and you will be awarded, suppose, by 5,000 rupees to your family, do you think it can affect in reducing maternal mortality rate?
Actually not, because this 5,000 is the cash. It will act as a placebo.
5,000 cash will act as what?
As a placebo.
Is the placebo. Okay. Why you think like it will be act as a placebo and not like an intervention?
No, because for intervention, you need to have a campaign, health education program,
Okay.
apart from drugs.
Okay.
But in giving cash, this will absolutely is not the intervention, true invention. I mean the substance which is going to bring a change, which we want to see, that will not have any effect.
But what about suppose in a community, those, suppose you have got two sections of in two families, two different type of families. So that is the population. Okay. By the way, what is the difference between a population and a sample? Yes. Anybody? What is the difference? Yes.
Sample is a subset of population.
A sample is a subset of population. Very good. So now suppose in a population, I have taken two families, where in one of the family, we are saying, if you follow institutional care, we will be giving you 5,000 rupees as a reward incentive for your family. Okay, because you have followed this institutional care. And in another group of family, if you follow an institutional care, I will give you some gift voucher. So these are two different ways of motivating a family member so that they follow the institutional care.
Then in this case, that the award, I think the money, that will
Money.
be an intervention substance, and giving you some other things which will act as a placebo.
Yeah, because that might work or might not work. Means,
Yes.
for example, it will be only for a particular period of time. Okay. Now, suppose if cash voucher can be availed only for 1 month or 2 months. And so we might think of different ways where it might affect the mindset of a person. Okay. So if whether you are giving any sugar tablet, or suppose you are giving ultrasound, for example, I take two group of patients, and both the group of patients are suffering from osteoarthritis. They come to me. In group 1, I have got 10 patients. In group 2, I have got 10 patients. Now in group 1, I take, okay, how in the group 1, I try to measure, okay, how much is your pain on day 1? So patient will say, okay, my pain is suppose on a VAS scale, visual analog scale. I try to measure the pain. So my pain, suppose, is the patient has rated as 9. That means 0 means no pain and 10 means very, very severe pain. Now out of 10, the patient has rated me, suppose my pain is 9. So that means the patient is suffering from a lot of pain. And then what I do, I take ultrasound machine and I try to give ultrasound over the knee. Okay. And then followed by this, the patient is made to do exercises and is sent home. So the same thing we do with patient 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. And we take a recording pre and post, pre-treatment and post-treatment. Maybe pre-treatment we have taken on day 1 and post-treatment we have taken on day 3, so that we can see what is the effect of the ultrasound on day 3. And exercise is given in both the cases. In the second scenario, the patient came, we took a pre-reading, and after the pre-reading, we gave the ultrasound, but then the switch was off of the ultrasound. And we take the gel and we keep on rubbing on the knee without having the therapeutic effect of the ultrasound. And then we try to see like what type of a difference the patient says after 3 days. Whether the patient says like, yes, my pain is less. Suppose on day 1, the first patient says my pain is 9. But on the third day, that's now, no, I feel a lot of relief and my pain is 3. In the other case, maybe the pain was 9 and now he is complaining of, or the pain has reduced to 6. So even without the use of ultrasound, we might say that the ultrasound is being given as a placebo. So which may be or it may not be, depending on the type of outcome measure you are trying to evaluate. Okay. So is it clear to everyone?
Now I have one query. 2 cases are there, but 2 groups are there. One group is the case group, the other is the control group.
Control group, yes.
So by definition, there was some definition by which we have categorized that this group of people will be cases.
So that means based on what you are saying is there will be an inclusion criteria. Okay, on the inclusion criteria, you have selected your patients.
Yes. The other group, which is control group. This means this group is similar in all respects with the case groups, but they are not diseased.
They are not diseased.
Yes.
Okay.
So
they are normal subjects.
Normal subjects.
Okay.
So in the case group, we are doing some intervention.
Okay.
Because they are having arthritis.
Okay.
So we are giving some interventions.
Okay.
And the other, what you have said, in the other group, we are giving ultrasound, but it is not actually ultrasound, but in the case of patients, it is there, the same thing is being given to them also.
No. In both the groups, you have got both osteoarthritis patient of grade 1. Okay.
Okay.
So your inclusion criteria is I will select osteoarthritis patients having grade 1 type of osteoarthritis based on the X-ray readings, and the same type of, after having the same type of criteria, following the same inclusion criteria, I will have 10 patients in group 1 and I will have 10 patients in group 2. Only the difference is in the group 1, the ultrasound is working. Okay, because when you give ultrasound to a patient, the patient does not feel any heat or something. So it is basically the sound waves which will be a causal factor for the intervention or the result. Whereas in group 2, what you are doing, the patient feels that the person is giving ultrasound, but in actual the switch was off. So maybe we want to see that ultrasound means definitely creates a therapeutic effect, or it is the effect of the placebo that the patient is having, like there is a reduction of the pain because of the placebo. Did you get the point?
Sure, good.
So what I mean to say, so then I can surely say that yes, exercises will have a definite effect in reducing the osteoarthritis pain, and maybe the therapeutic intervention of the electrical modality will not have any effect. That means if any patient who is giving an exercises will definitely going to help the patient, but maybe we cannot categorically or confidently, statistically, we cannot say that maybe this electrical modalities will be of some use. Okay, this is the difference. Then when you have the case control study, then based on the case control study, the higher level next goes your systematic reviews. Now in systematic reviews, what we do, we are basically trying to get all type of literature regarding that problem or disease. For example, you can say, if we want to see what is the treatment for rheumatoid arthritis. So maybe because now there is a different generation of drugs which is being used. 10 years before, there was a different generation of drugs that were used. And then also the palliative treatment. Okay. So the palliative treatment is also going to add a lot, because what do you mean by the way? What do you mean by palliative treatment, Babicha? What do you mean by palliative treatment in public health? What do you mean by a palliative treatment? Yes, Babicha. Why I use this word palliative in rheumatoid arthritis? What do you think is the meaning of palliative? Yes, Babicha, are you there in the class? I can see you. Yes, Ujjwal. Babicha.
Sir, actually, palliative means to relieve symptoms and improve your quality of life.
Okay. Okay. So is it curative?
No, sir. So it is not a permanent cure or curative.
It is not curative, huh? Okay. Okay. So palliative treatment, that you cannot cure it, but you have to manage with it. Like rheumatoid arthritis cannot be cured. Okay. So it is but you can definitely improve the quality of life.
Yeah,
okay.
one query is that in case of palliative treatment, the emotional support or the rehabilitative support, or you can say other things other than the actual treatment. So those things are, or the care, those things are taken care of.
Yes, because you want to improve the quality of life.
Yeah.
For example, if there is a case of ankylosing spondylitis, now that person will, suppose a patient came to you, the patient's age was 18 years of age, and suddenly he complained of like, I cannot turn on the bed. Okay, then you ask the patient to go for did a physical examination, you asked his family history, you ask the person to go for an HLF B27 test, and it came to be positive. And when you ask, yes, he had this familial issue and his father was also with the same problem. Now you told him because his age was only 18, 19 years. So you told him because he has got almost like 60, 70 years, if suppose he has got a lifespan. So he should be able to maintain a near normal. So you have to give him all the advices so that you can improve his quality of life. For example, you might have to say, like, you should not sit at one place for a longer time. The type of exercises like swimming is very good for you. Okay. Whenever you are trying to, don't use any type of a rotatory chair at home. So your range of motion is maintained in the joints. And at the same time, you can use different types of, therapies so that the patient's quality of life is improved and he can lead a near normal life than like any other person. The disease would be there. It won't be, because you can only manage the exacerbation or the severity of the symptoms, but it cannot be cured. Okay. Is it clear to everyone? So that is
Yes,
a
sir.
like a palliative treatment. Now you see, so in a systematic review, I will be dealing with all these important terms. What is a systematic review? Then what are the different types of systematic reviews? So these are all a part of all your research studies. So in a systematic review, we are basically a time zone wise, we write a whole account of the various studies or various things that have been done in the past till the present time. So that is basically a systematic review. Then a different type of a systematic review is a meta-analysis. Now in a meta-analysis, you will have the statistical usage in order to suppose for COVID-19 there are means 20,000 studies that has been already being published in the last 2 years, suppose. Now what I'm going to do is I'm going to evaluate those studies based on my inclusion criteria, and and then I'm going to, so I need to frame a hypothesis. Now what is a hypothesis? What are the different type of hypotheses? I will come to this point. So before I frame a hypothesis, and then I'm going to see which all studies out of these 20,000 are match that criteria, and what is the statistical evaluation of such a design, like which studies I should consider and what type of a result they are giving it to me. For example, suppose if I take a disease like night eating syndrome. Now I have taken this study in, like, night eating syndrome is a disease which can happen in majority of the adolescent, where they have a tendency to eat in the night. Now, why do they have a tendency to eat in the night? Why do they feel? Because of some psychological reasons. Now, if I want to find out a prevalence rate in such a case as a part of my public health study, so what I'm going to do, I am going to take the various studies across the different world so that I can statistically measure it, and I can confidently tell you like which group is more prone to get affected by night eating syndrome and which gender. Okay, is it the male versus? So I've got a very specific two research questions: whether night eating syndrome affects more females than the males or more males than the females. So I told you previously that whenever there are two type of scenario, either A is equal to B or A is not equal to B. When I am saying A is not equal, A is equal to B, that means I am talking about your null hypothesis. That means both are same. So in this scenario, if I am saying that night eating syndrome has a chance to affect both male and female equally, that means A is equal to B. That means I am assuming that either male can be more, that both male and female can be equally affected. The reverse of this scenario, or the opposite of this scenario, is A is not equal to B. That means either males are more affected than females, or females can be more affected than the males. So this is my hypothesis. So based on the various studies which have been done around the world, I tried to make an inclusion criteria. I try to see what is the age group in which they have been taken. And then we try to statistically measure it to confidently say that whether my alternate hypothesis is accepted or my null hypothesis is being accepted. So this type of a study is known as a meta-analysis study. Is it clear to everyone? Is it clear to everyone? What do you mean by a meta-analysis?
Yeah, absolutely clear.
So here
Yes, sir. Yes,
basically,
sir.
okay, here basically we create a forest plot. So how does a forest plot look when we will do the individual studies? So this is basically the background of the various research design, and then after meta-analysis we have got RCTs, okay, randomized clinical trial, where we compare two different groups of drugs or different groups of drugs. We can make different experimental. So that is a part of your experimental design. So these were the various things. So this was the background that we have already discussed. Now see, when I am saying like this example which I just gave you, okay, whether A is equal to B or B is equal to A, okay, or A is not equal to B, that means what type of a research hypothesis is this? It is a bivariate. Because see, important thing in any design is what type of a variable you are using. What do you mean by a variable? What is a variable? What is a variable? Yes. Any idea what is a variable?
Yeah, the number which varies. For example, age, sex,
Okay.
or
So
BP, blood pressure.
so age, sex, blood pressure. So what are these? These are the properties. Okay, these are the characteristics. So if you say in a patient, I've got age, sex, occupation, gender. What are these? These are all socio-demographic factors of any patient, right? These are the socio-demographic. For example, if my research studies title is, I want to whether the age of the mother and weight of the child are related or not. Suppose if I make a hypothesis, like if the age of the mother is less, then the weight of the child will be less. If the age of the mother will be more, then the weight of the child will be more. So that means suppose if I am hypothesizing that in case if the age of the girl is less than 18 years of age, then there might be a chance that always the babies which are born in such females which are underaged, then they have a chance, there's a high chance for infant mortality, or the babies would be basically preterm, or we might say will have a low birth weight. If this type of a hypothesis if I'm seeing, so what I'm trying to see, I am trying to see the correlation between the age of the mother and the weight of the child. By the way, age and weight, what type of a variable is this? What type of a variable is this? Is this a nominal variable, nominal, ordinal, interval, or ratio? How many of you know what are the different types of variable? What do you mean by different types of variable? Any idea?
So person, place, things. So place means depend upon weather. Different places depends weather.
Okay. See, here it is written, associative research hypothesis show a statistical relationship between the variables. So therefore, there are two different types of variables. One is a dependent variable, other is an independent variable. You should always remember all the characteristics of any population, socioeconomic characteristics. For example, age, weight, means age, weight, occupation. So all the characteristics about a society, socioeconomic factors, they are always called the dependent variables because it is dependent on the other variable. So if I say age of the mother and weight of the child, between these, which is the dependent variable and which is the independent variable? Yes. Between the age of the mother and weight of the child, what do you think? Which is the dependent variable or which one is the independent variable and why?
सर एक्चुअली एज तो हमारे पास है ना, एविडेंस तो है, इसीलिए डिपेंडेबल एज वेट एविडेंस की तरफ पे।
तो एज ऑफ द मदर आपके हिसाब से डिपेंडेंट वेरिएबल है, इंडिपेंडेंट वेरिएबल है?
सर डिपेंडेबल डिपेंडेबल
डिपेंडेंट वेरिएबल है एज।
यस।
एंड वेट ऑफ द चाइल्ड?
डिपेंडेबल।
एज ऑफ द मदर भी डिपेंडेंट है और वेट ऑफ द चाइल्ड भी डिपेंडेंट है।
यस सर।
Weight of the child.
These are all independent.
Age of the mother is an independent variable. See, weight of the child, you are saying the weight of the child is dependent on the age of the mother, isn't it?
Okay.
Weight of the child is dependent on the age of the mother. अगर ये आपका हाइपोथेसिस है कि यस, अगर मदर की एज कम होगी तो बच्चे का वजन भी कम होगा, आप ये हाइपोथेसिस कर रहे हैं, दैट मीन्स मतलब 18 साल को अगर आप इसको क्राइटेरिया ले रहे हैं, इफ यू आर टेकिंग अ क्राइटेरिया फॉर 18 years and saying that if the girl, any girl which is less than 18 years of age, suppose the girl is 12, so you might have got different subjects where the girl might be 12 years, 13 years, 14 years, and then you see the corresponding weight of the child when they are born, right? So you are trying to see that if the mother's age is less, that what is the probability that the weight of the child will be normal or abnormal. So that means weight of the child is depending on the age of the mother. Okay. So in the same phenomena in an RCT, when you are taking the age, weight, the various characteristics, socioeconomic characteristics, they have been called as a dependent variable, whereas the intervention, the drug, suppose you are comparing between two group of drugs, that means you are taking in one group paracetamol and the other group may be used as a diclofenac sodium, and you are seeing that which one works as a better painkiller in osteoarthritis, then the drug that you are giving will be an independent variable in such a case. Okay, and you are trying to see a relationship whether here you are basically not a relation but as a comparison, because you are doing an RCT. But suppose you are trying to see the relationship between two variables. For example, do the children during the corona, since they were at home, did the children has a more inclination for using mobile, and the addiction has increased or not? Now suppose this is the research study in public health, like because there was a lockdown for almost like 2 years, the children are not going to school, so at home the environment would be in such, like whether the corona has really increased the mental stress in the last 2 years or not. So you are trying to establish a relationship between two variables, that is the effect of corona and the level of the mental stress. Okay, so this is basically a type of a causal relationship, that one thing is the cause and the other is the effect. That because, for example, like smoking and cancer, like whether smoking can lead to cancer or not. Okay, so cancer might happen because of smoking, maybe or may not be. Do every person who smokes will have cancer? Maybe or may not be. But because we are hypothesizing that since those people who smoke more, Therefore, the carcinogen agents go inside their body, and as a result of which there will be an increased chance. Then the question comes, how much there's a chances of increase. So for this, we use a statistical tool known as the odds ratio, OR, odds ratio. Odds ratio is the when you calculate an odds ratio, it will tell you like how much time, okay, there's a probability that the cancer, that the chance of getting cancer will be increased 2 times, 3 times, 4 times than the group with which you are comparing. Okay, so this type of a relationship is known as a causal relationship or a causal research. So in a causal research hypothesis, you are trying to see in terms of time, that is a temporal, and you are trying to see a statistical relationship between the two variables. If variable A is increasing, what is the effect on variable B? If A is increasing, then whether B is also increasing. For example, if you have an increased consumption of meat, there will be a proportional increase in the triglycerides level of a person. Okay, so this is type of a statistical relationship between two variables. And then no alternative explanation for a variable, that means there is no explanation for the same. Is it clear? Is the example clear to everyone about a causal relationship?
Yes, sir. Yes, sir.
Yeah.
Okay. And then when you use certain things in research, you will always look for the validity of that equipment. What is the validity and what is the reliability of the equipment or the study? So what do you mean by validity? What is meant by validity? Yes, what is meant by validity?
Validity means that if the result will be the same, if it is if it can detect two cases every time, the same result comes, then the test will be, you can say that it is valid.
No, if it gives the same result every time, then it will be a reliability. It will be a reliable test, not a valid. Okay, validity is it is the property of an instrument to measure what it is intended to measure. Okay, it is the property of an equipment or an instrument to measure what it is intended to measure. जो चीज जिसके लिए बनी हुई है, क्या वो चीज उसको नाप पा रही है कि नहीं नाप पा रही? For example, if you are doing a Vidal test for typhoid, and whether it is able to measure it or not. For example, if you are using a goniometer to measure the range of motion, whether it is measuring or not. Whether if you are using a thermometer to measure temperature. So thermometer is meant to measure temperature. Goniometer is meant for measuring range of motion. Okay.
Yeah, that means the ability to detect that true case.
So it is the property of the equipment to measure what it is intended to measure. You will not use a goniometer to use temperature because it is being used, or a weighing machine to measure a weight, right? So this is basically known as validity of an equipment. Okay, so in validity, and if it is measuring the right, it is measuring it correctly again and again, irrespective of time. Okay, for example, in the morning when you measured my weight, it is showing to be 75 kgs. Again in the evening, again 75 kgs. But it is not, then that means it is both valid as well as reliable. But suppose in the before 1 minute you measured my weight, it came out to be 75. Again after 1 minute you measure, it came out to be 78. Again after sometimes, so sometimes the same equipment is giving me a value of 75, sometimes 78, sometimes 81. So which value I will, so I won't tell it, or I won't say it is a reliable reading. This is reliability. Okay, so this is the difference between reliability and validity. So validity is the property of an equipment to measure what is it is intended to measure. So we have got different types of validity. Okay, here there's one classification, then there's construct validity, content validity. Will come to those points. But that means there is a measurement validity, there is an external validity, there is an internal validity. Okay, and then that means two ways we show our studies to have the validity. We hope like this, if you are replicating the same study, you are doing it again, and it is not showing much of a variation. Okay, so suppose some person has did some study, and in that study the result, the person is saying, the researcher is saying, or the scientist is saying, yes, my p value has come to be 0.003, which means that out of 1000 patient, if I do this study 997 times, it will always give the same result. So that means I am very confidently saying that yes, the effect is because of my intervention and it is not because of a chance. This is what is the meaning of this validity and the reliability of a study. Is it clear to everyone?
Yes, sir. Yes, sir.
Okay. So when you see for the, so we basically in any of the study we check for external validity. That means we are we want to see what is the population type, where, so population is basically population is the different type of sample where, you know, because you are choosing the sample from that population. So where you actually want to do this study. For example, if I want to do and see the effect of COVID vaccine. Now, COVID vaccine in adults or in children. Now, see, this is a population group. Okay. For example, the effect of education among male and females. So maybe male will react in a different type of education and female will react in a different manner. Okay. So you have to choose what type of a population is it, which type of a setting that you are doing the study. Are you going to do it in a rural belt or in an urban belt, or you are going to do it in suburban population? Okay, then what type of a task or stimulus you are trying to give for that study, and whether the effect will be more of a social or a temporal effect. So based on all these factors, we are trying to evaluate the causal interpretability of the results, whether the factors like this is causing this problem or not, or this disease or not. So we are trying to understand these phenomena. And then you have got various types. So that means in the same subject, suppose like a guy gave the example of range of your osteoarthritis. Now in group A, when you are saying that you are comparing between two different groups of drugs, so what you are measuring pain in that person. So pain is one outcome measure. The second outcome measure could be your range of motion of the knee. So this is a second outcome measure. The third may be your functional index, that whether the person is able to sit properly or not, whether the person, how long a person can walk freely, whether after walking, whether in how much time the pain comes and in how much time the pain again goes. So these different type of factors will give you the functional index of the so these whatever you are doing it, it will be all called as a measured variables, because you are measuring these variables. Now suppose if you are giving some intervention, suppose you are giving treatment. Now you are giving drugs in these cases. Suppose you change the drug dosage. In some case you give 50 mg, in the other case you give 100 mg, then you give 150 mg. So it is, you are basically doing a manipulated variables, because you can manipulate your variables. And in manipulated variables, that means you can manipulate which variable? Independent variable. So the range of motion, the pain in the patient, the functional index, these are all different types of dependent variables. And the intervention what you are giving is the independent variable, or they are also known as manipulated variable. So this is the difference between measured variable and manipulated variable. Is it clear to everyone? Is it clear? Yes, Babicha.
Yes, sir. Yes, sir.
Yes. Dr. Hussain, is this clear?
Yes, just tell me, let us recall this social and temporal one. This the components of validity, social or temporal.
Huh. So social validity in terms of, see, temporal will always be in terms of time. Okay, distance, time. So suppose you are saying that I will give an example. Suppose you have seen somebody uh, at the age of 40 years, okay, and then you are seeing the same person. You are doing a study, a cohort study, where you are taking reading after 1 year, after 2 year, after 3 year, after 4 year. So this type of a study would be more related to a temporal type, because you are trying to
In
measure
relation
the
to time.
with relation to time. Yes. Okay, so we will be measuring in relation to time. For example, these studies are used basically in cohort studies. For example, if I want to study the deterioration in particular component, or I want to see the behavioral effects. Okay, for example, any patient who has suffered from post-traumatic, post-stress traumatic disorder, PTSD. Okay, suppose a patient with terrorism. Now in a population, we see how do the children of, the children of those parents, they behave over a period of 2 years when they had undergone any episode of trauma. Suppose this is my case study, means this type of a study I want to do in public health. I want to, so it can be, so you have to measure their level of trauma, that whether with time the trauma has gone down, or still the trauma is there, or the trauma has increased, and what are the factors which are responsible for that will have an effect on the trauma. So that means your research question over here would be to understand the potential factors or the critical factors that can affect trauma in such cases. Is it clear? Okay, so that means we will have different types of causal variables. So we want to basically see the cause and the effect relationship. Okay, and then there are various confounds. So what are the different types of confounds? What are its effect? So we, okay, before I come to this point, like I was discussing with you, what do you mean by data? Like, because see, in every research study you will be collecting data. So what are the different types of data? Because in order to understand variable, before I come to dependent variable, independent variable, I just want to make you understand, like, because see, whether you manipulate the variable or you measure the effect variable, you should, these are all different types of data. So my question is that I've got two questions. Number one, what is the purpose of data? Why we do measured data? And secondly, what are the different types of data? Yes.
Data means information.
Data is information. Okay, very good. So for example, now, why do we collect data? What is the purpose of collecting data?
To
Yes.
know the to know what is unknown.
To know what is unknown. Okay, I agree. Now, what will happen if you know what is unknown then? If I want to know, and if I've known what is unknown, previously it was unknown, now I know it. Now suppose if I tell you, okay, previously I was not knowing what is a nominal data, what is an ordinal data, what is an interval data, what is a ratio data. So now suppose, now after the class you have got this information. So what does it transform to? How does it help me as a researcher, as a public health researcher?
Sir, measuring information variable.
Yes, Ujjwal. What is the purpose of data? What is the purpose of data? What is the purpose of data collection, analysis, synthesis? Yes.
To get information and take some action.
Okay, very good. So all the data has to be converted into information. Okay, because if I say 160, but if I don't put the value kg, I won't know whether 160 is what I'm talking about, pressure or, you know. So that means the information has to be in a proper manner. Okay. So
Sir,
my question,
ensure accuracy and facilitate data analysis. Ensure and facilitate data analysis.
okay,
The
it will
accuracy,
facilitate.
particularly.
So what it is leading to? Okay, you have now facilitated because of this data, you are doing analysis. Okay, great. I agree with you. But then what is the purpose then? Okay, you are doing analysis. Okay, good. From a public health perspective, what is the purpose? Why do we do gather data, collect data, then the methodology in which we collect it? Okay, then we try to segregate it, then we try to analyze it, evaluate it, synthesis. Yes. Yes, Shamta is not saying anything today. Why Shamta is quite.
Sir, health is
Okay, your system is not good today.
For
Yes, baby.
prevention
Yes.
and control,
Huh?
so that we can take prevention and control measures.
Okay. Okay, that is also one of the objectives. Okay, agreed. See, the
Sir,
primary.
measuring
Yes.
information on variable of interest.
Okay. So if suppose I have to explain it in a very simple term, I would say the purpose of data is to get information. This information has to be converted into knowledge, and that knowledge has to be converted into wisdom. Isn't it? This is the purpose of any data. That information has to be converted into knowledge. Now, if you have got the right knowledge, and that right knowledge will give you into wisdom, that is experience. When you do it again and again, and you know what to do and what not to do. Agree or don't agree?
Sir, agree.
Okay. So this is the purpose of data. So data, all the data of the world, it has to be converted into information. Then as a systematic, this information has to be converted into knowledge. That ultimately what you are getting out of it. And that knowledge has to be converted into wisdom. Now, if I say different types of data, so there is a classification. There is a primary data, there is secondary data. There is nominal data, there is ordinal data, there is interval data, there is ratio data. So my question is, and these are all will be different types of variables. Okay, because suppose if I am saying age of a person, what type of a data is it? Is it nominal data, ordinal data, interval ratio, or ratio data? Nominal, ordinal, interval, ratio. Yes, any idea?
Sir, age is a ratio data.
Age is a ratio data. Why it is called a ratio data? What is the difference between nominal, ordinal, interval, and ratio?
सर पहले बोला इसलिए बोला.
Huh? Yes. Yes, Babicha. Any idea? What is the difference between nominal data? अगर मैं बोलता हूँ एज ऑफ अ पर्सन, अगर मैं बोलता हूँ वेट ऑफ अ पर्सन, अगर मैं बोलता हूँ जेंडर ऑफ अ पर्सन, तो जेंडर किस टाइप का डेटा है, एज किस टाइप का डेटा है, इनकम लेवल, सपोज मैं अगर बोलता हूँ द इनकम ऑफ अ पर्सन फ्रॉम 5,000 to 10,000, आपको कैटेगराइज करना है 5,000 to 10,000, 10,000 to 15,000, 15,000 to 20,000, ये भी एक टाइप का डेटा है. दीज आर ऑल डेटा. अगर मैं बोलता हूँ मोटिवेशन लेवल, हाई मोटिवेशन, लो मोटिवेशन, satisfaction level, high satisfaction, ये सब डेटा है. These are all different types of data. तो इसलिए रिसर्च स्टडी करने से पहले we should all know that what are the different types of data and which category do they fall. If it is clear to me, then only we can understand that whether this type of a data will accurately be able to measure the different type of research question or the objectives of the question that you are looking at. Okay, whether it is appropriate. So you have to be very critical in choosing and in understanding the complexities of any research study so that you can get the right answer for the right type of question that you are asking. Okay, am I clear to everyone? That what is the purpose? It is very important. It is the most important component of any research, because if the research design is not proper for any public health research, then automatically the results won't be good. Whatever you will be getting will be a flawed result. And maybe if you are doing any study, then there will be also difficulty in the publication of the result or in the study if there is a controversy regarding the same. So my question is, what do different types of data means? What is the difference between nominal, ordinal, interval, and ratio? Yes, Dr. Hussain, any idea?
I have to recollect once again.
Okay. So nominal, any type of a nominal data is basically when you basically put them into category. Okay, for example, male and female. So if my research question is, okay, that rheumatoid arthritis affects which gender more? If this is my research question, what is the probability of, or what is the correlation between rheumatoid arthritis and gender? Whether it affects male or female. For example, we say that rheumatoid arthritis is 6 times more common in females as compared to male, and vice versa. Ankylosing spondylitis is, the prevalence of ankylosing spondylitis is females. In females, it is 3 times more common to have rheumatoid arthritis as compared to male. Whereas if I say that ankylosing spondylitis less than 30 years, it is the probability of affecting the males is 6:1. Like out of every, 6 males can be affected by AS as compared to females, and after 31:1. That means I'm talking basically about the correlation between a gender and the causation of a disease. Am I clear? So here, yes, Dr. Hussain, am I clear about this point?
Yeah, sure.
Okay, so here, basically, if you take gender, for example, in any socio-demographic, so if you take gender, male, female, now this is basically only categorized into 2 groups, A or B. Or for example, take blood group. Okay, AB, and O. So that again, this is a group. Suppose I take another group like religion, Hindu, Muslim, Sikh, Christian, and others. So again, it is so where I just put everything into a fixed category, then it will be called as a nominal data. All these types of, where you are in a fixed category, all these type of data will be classified under nominal data. Is it clear? Is it clear
Yes,
to
sir.
everyone? Okay. Now the second category is your Shamta. Is it clear? Okay. The second type of category is known as ordinal data. Now, ordinal is basically based on order, okay, rank order. For example, how much satisfied, highly satisfied, moderately satisfied, not satisfied. So this is an order. For example, if I have to measure pain, okay, so pain, if I say 0 means no pain, 5 means moderate pain and 10 means very severe pain. Or if I give a visual analog scale, 0 means no pain and 10 means very severe pain. So I will rate from 0 to 10, 0, 1, 2, 3, 4, 5, 6, 7, 8, 9. Okay. So then this type of a data is no pain, or income level, high income, middle income, low income. So this is all an order. Okay. So this type of an order will be, and why it is called as an order. For example, say if suppose, okay, I'll give this example later. Let us first understand. So this is an order. Okay. So this type of a variable is known as an ordinal variable. So nominal, ordinal. The third type of a variable is called interval variable. Now, interval variable, that means you have got equal intervals. For example, if I am taking the range of motion in any patient, if we suppose we are measuring range of motion. So in range of motion, we are saying now, suppose the patient is suffering from frozen shoulder, and the patient is able to move the abduction of the shoulder is, say, suppose only 30 degrees. Okay. Now you give treatment to that person, and now after 1 month, means after 1 week of treatment, now the range has increased to from 30 to 50 degrees. So I would say the patient has got an increase of 20 degrees. Okay, because it has improved by 20 degrees. Then after 1 week, again, now it becomes 70 degrees. After 1 week, it becomes now 90 degrees. So from 30 degrees till 90 degrees in 1 month of time. So this is the absolute. So what you do, so it is being divided into equal intervals, 10, 20, 30, 40, 50, 60. So this type of a data is known as interval, because it is based on interval, proper interval. So suppose if I give an example, so suppose if I say I am seeing this patient number 1, the patient is suffering from osteoarthritis. The patient came to me, and then I am evaluating the effect of certain treatment in the patient of osteoarthritis. Now on day 1, when the patient came, the pain, the level, when I ask the patient, okay, how much is your pain, the patient will give us a subjective phenomena of, the patient will say my pain is now, say, 8. So I give treatment for 3 days, and after 3 days the patient would say my pain is 4. So, and then I get another set of patient where the patient will have said that my pain was 9 and now it has come up to 5. So can I say the pain, the reduction of pain in patient number A and the reduction of pain in patient number B are same, A is equal to B? Can I say this? Did you get the question?
Yes, sir. Yes, sir.
So in patient number 1, the pain was previously 8. After treatment, now it has came up to 4. In patient number 2, the patient reported of 9. Now it came into 5. So can I say reduction in A is equal to reduction in B?
Yeah.
Yes, sir. Yes, sir.
Okay. We can say this, huh?
Yes, sir.
Confident?
In this
Yes, sir.
example which you have cited, here we
Yes.
can have 2 types of data, na? Ordinal data and interval data both.
Ordinal data and
Because we
ordinal
can
data
have
also.
this pain which may be grouped. I mean, it may be severe or moderate or mild. And again, the as per the rotation of the arms to related to degrees of movement,
Yes.
then that can be also be. Then we can have an interval variable also. So in this
Yes.
station, 2 types of things can happen.
No, what you said is absolutely true. We are collecting 2 different types of data. One is pain, other is range of motion. Okay.
Yeah, yeah, yeah.
Now, in patient number 1, I told, like, when the patient came to me on day 1, the patient rated their pain as at 8. Now after treatment, after 3 days, the patient said, now the pain has come to 4, means there's an improvement by 4 points. Okay. In patient number 2, in another group, I gave again the same patient, different patient, and the patient rated their pain was 9. Now after 3-4 days of treatment, now the patient says my pain is now 5. So
So, yeah, so the
are
relief
both the
interval is
data
same.
same?
The
Are
relief
both the
interval is
improvement?
yeah, both the in that case, I mean both the range is same.
Both the range is same. But do you think the improvement in both the cases same? Here also 4, there also 4. Since both are 4, 4,
May not be.
may not be. Why? Why? Why did you say so that it may not be? Yes, even though both are showing 4, 4, but still I
Uh,
won't say the improvement in pain won't be the same. Like the here also 4, here also 4.
because the reason is this, that in the first patient, as you have said, it was 9. The score point was 9, and it has the pain has come down to 5.
Okay. So there's a
That
gain, there's an improvement by
there is
4
improvement.
points.
Yes, definitely there is an improvement of 4 points.
Yes.
So, but if the patient, the second patient, the score point was 8, and
Yes.
the reduction, the last point was 4, so interval remains the same 4. But in the second patient, the pain severity of pain was less.
Yes. Even though the severity of pain was less, but see, important component over here, what is to understand is pain is a subjective phenomena, right? So you cannot actually rely on the patient, what the patient is saying always. For example, because patient will tell, according to their own judgment, because you ask the patient to rate it. So the patient rated it. For example, the first day, the patient will say, my pain is now 8. After 3 days, now the patient pain is 4. Okay. Then after 2 days, then you forget. After 2 days, again, you ask him, how much is the pain? The patient will say 5. Because patient forgot that 2 days before the pain he or she rated was 4. Are you getting this point? So what I mean to say is pain is a subjective phenomena. Whereas when you use an interval data, it will always be an objective phenomena. For example, if the same patient, now the patient range was how much? It was say 30 degree. After 3 days of treatment, how much the shoulder range increased? It increased now to 50 degrees. So how much is the gain? The gain is by 20 degrees. Okay. In the another group of patient, the pain, the shoulder was moving at 70 degrees. After 3 days of treatment, now the shoulder now moved to 90 degree. So here also 20 degree, there also 20 degree of gain. But here I can say that this is a reliable, because in every human being, irrespective of anything, the whole range of motion would be only 180 degrees for the shoulder. So gain in group 1 will be the same in group 2. But the same thing I cannot say for a pain, because pain is a subjective phenomenon, whereas range of motion is an objective phenomenon. Is it clear?
Very good.
Okay. So
Yes,
that's
sir.
why in medical sciences, it is more valuable to always go for an objective data. That's why, which the patient cannot manipulate. That's why when you take any blood CBC, so WBC you cannot manipulate. So whatever, so your actual values will give you the true indication of the type of the disease which is there inside the body, what is happening inside the body. Whereas in a subjective phenomena, it can be manipulated easily. For example, if suppose I am the researcher and I want to know, okay, maybe who knows, like I want to manipulate the results myself, because I am the one who is taking, and I just want to, it is something, in any of the government departments, when they go for any survey, for a public health survey, they will ask, okay, whether this scheme benefited the stakeholder. So they themselves put yes, yes, right, right, okay, very good, very good, very good. And so it is not a true measure, because it can be manipulated easily. So any subjective phenomena can be manipulated quite easily. And therefore in social sciences, even though, because it is very difficult to have an objective index of any behavioral thing. For example, satisfaction, for example, irritability, okay, anxiousness. But we try to use an objective tool even for the same. But in real sense, if we say that in any of the subjective phenomena, the reliability, for example, now take nowadays, the government told, like, how much was the death of the patients from corona in India? 4 lakhs. But what do the WHO said? We don't rely on the Indian data, because according to the statistical mathematical modeling of MIT, it is almost like 12 times. So what they said, according to the MIT studies, in India, the COVID deaths almost touched up to 48 lakhs. Because the government bodies, what they are saying, like on the register, no death, no death, no death because of COVID, death because of heart attack. But because that is only they just tick mark, and they said, and that can be counted as a, because that could be manipulated easily. But then when there are actual deaths, in a normal case, when there will be deaths from stroke, from other, then where did the death of the COVID occur? And when you have got so many deaths, so when they took the statistical modeling from various states, okay, and then they put it into, so roughly what they calculated is the death from COVID in India was almost to the tune of 48 lakhs. So see, both were data, but the Indian data was not reliable, but the MIT data was reliable, and what MIT told to the WHO, it was finally accepted. Okay, is it clear? Are the different types of data nominal, ordinal, interval? Is it clear to everyone?
Sir, I have question.
Yes, sir.
Yes.
Sir,
Yes,
actually, when hello, sir.
yes, I'm listening.
Sir,
Yes,
when patient complain first day,
okay.
here pain is moderate, but after medication second day 4, after 2 days, pain is increase.
Okay.
Then the data is no ordinal data.
No. See, the pain, you can always ask. It's just a phenomena. Because you are trying to measure pain. So pain is basically a subjective phenomena.
Okay,
Now,
sir.
so how much? Now, suppose the patient has said, I asked the patient, हाँ भाई दर्द हो रहा है? अच्छा कितना दर्द हो रहा है? Patient कहता है डॉक्टर साहब बहुत दर्द हो रहा है, बहुत दर्द. अच्छा बहुत मतलब कितना? तो I suppose I gave a value. 0 मतलब कोई दर्द नहीं, और 10 मतलब इतना सिवियर दर्द हो रहा है तुमको जो तुमसे बर्दाश्त भी नहीं होगा. You cannot even tolerate, right? So
Yes,
I
sir.
asked the person to rate your pain according to this. तो डॉक्टर साहब हो रहा है पर सहन कर लेता हूँ. अच्छा कितना दर्द है? डॉक्टर साहब 8 हो रहा है. Okay, very good. अब you gave the treatment to that patient. The patient came to you for 3 days, 4 days. हाँ भाई आराम है जी डॉक्टर साहब, अब तो काफी आराम है. अच्छा कितना आराम है? तो डॉक्टर साहब अब 0 मतलब बिल्कुल दर्द नहीं है, और 10 मतलब बहुत सिवियर दर्द है. डॉक्टर साहब अब तो 4 लग रहा है. ओके फाइन. सो आई रेटेड. So because I am having the questionnaire and I rated the first pain as 8, now it is 4. Okay. Now again I measured it after 3 days more and I asked him, okay, अब कितना? डॉक्टर साहब अब तो बहुत ही आराम है. Okay, अब कितना है? Okay, अब तो डॉक्टर साहब 2. So that means from 4 I came up to 2. That means what you are. But suppose the patient, but how do you know that what the rate patient is giving to you is actually true or not? And it cannot be manipulated. It is not manipulated by the patient.
Exactly. We cannot measure. We cannot
You
measure.
cannot measure it. But suppose if I'm taking the blood of a person and I'm giving you the RBC value, WCBC value, okay, so it will actually tell what is the state of the disease in the body. Now, if suppose if I've got biomarkers, okay, I've got biomarkers where I would say, okay, maybe in WBC numbers are raising when the patient is having an acute state of trauma. And, I would say, okay, now fine. Now, because since the treatment is effective, and therefore the substance P, which might be used as a biomarker, or maybe any inflammatory biomarker, interleukin level may be getting down. Because since the inflammation, if there is a reduction in the inflammation, so definitely I would be able to measure it in the blood, and it cannot be manipulated by the patient. Okay, though it could be
Okay.
costly because the patient has to go for it. But in the purpose of research, we always keep a different budget for all these things, because always try to measure the objective data, because objective data will give you the true picture, true indication. You got the point?
Yes, sir. Yes.
Okay. So I think for today it is more than sufficient. Okay. So
Okay,
in the
sir.
next class, we will be continuing with the same. So in the next 2 lectures, I will be finishing.
One question is there,
Yes.
which for beginners in research methodology, which book you propose to us to
We
refer?
will be providing, Dr. Sen, we will be providing you the books as well. I will
Okay.
ask Tofik to send you the books. Okay.
Acha, acha,
So it
okay.
is the same books you have to follow.
Because in the usual books which we usually follow, that is your Park and this
Yes, preventive and social medicine,
or
Park. Yes.
comparative medicine by
Yes.
Sudhakar. This everything in social preventive medicine, this research methodology part is not there.
Yes, I know. That's why,
Some biostatics are there, but
whatever, yeah, whatever I will be teaching, it is more from a public health perspective to become a
yeah,
public health researcher.
yeah.
Okay. Okay. So you need not worry about it. And the last one, sorry, I forgot to tell you regarding the ratio. Okay. Now the ratio is even much more better than the ordinal, because in that interval, because in ratio, you can also measure up to point decimal places. For example, take temperature. Now your tool is sensitive. For example, the temperature of a person was 99.1, 99.2, 99.3. That means even you can measure up to point decimal places. So the equipment is even more. For example, the weight of a person. Now my weight is 80.1, 80.2, 80.3. So if even there is a small difference of the weight, for example, if after COVID, the weight of a person increased by 3 kilogram, 3.2 kilogram, like even 0.2 kilogram you are able to measure. So that much sensitive your equipment is. So if you have got, so the more, so see, the best type of a data are those data which perform all the function of mathematics, that is addition, subtraction, multiplication, and division. Okay. So that because what type of information, guys, again I come to the same question. What is the purpose of data? To give you information. Now what information you see? The first one is given, nominal, yes or no. Whether are you male, female, yes or no. With which category you write, either male, female, or blood group A, B, ABO. So how many people have got O positive? 5. How many of the people who have got A negative? Maybe 3. Only this information I am getting, right? Not getting any more information. So this is basically nominal data. The second one, say, suppose if I am saying, okay, in which category did you see the maximum pain? So maybe we got in 4 patients. Okay, how much was the pain reduced? The pain was reduced to almost a moderate level. Now, how much is the moderate level? I cannot tell you, but it is still giving me an information. Yes, it was more, but now it is less. But how much less, it is not telling me. See, now you get even a little more information. The third one is the interval. Now in interval, I say, okay, the range of motion has increased by how much? There's a gain of 20 degree. So it is giving you a little more information, better information than the previous one. So the gain is it is an increase by 20 degrees. Because you can measure, there is a difference between 20 degrees and 10 degrees. So definitely there is an improvement by 20 degrees. Now take the fourth category, that is the ratio. Yes, there's an improvement by 20.2 degrees. So it can measure also up to 0.2, 0.2, 0.3. For example, in any CAT exam. Okay, now in CAT exam, why do we calculate percentile? Because percentile. So for example, one student got, there are 4 lakh students who appeared for the exam, and now the student, between 99 and 99.8, there were 300 candidates or 200 candidates, but somebody who got 99, the other person got 99.1, 200 people got 99.2. Then you want to see how many have got 99.2 more in physics, chemistry, like this. So it can also measure up to point decimal places. So even if you want to 99.11, 99.12, 99.13, even you can calculate how many decimal places. So the more you can count up to decimal places, that means more accuracy it have, and it is more sensitive tool and will give you more information. Is it clear to everyone? Yes. So you have got 4 different types of data: nominal, ordinal, interval, and ratio. Okay, and these data can be classified into different types of variables. Is it clear, Dr. Hussain?
Very nice.
Yes, sir. Yes, sir.
Okay, don't forget this. This is the basics for any research. Okay, if you don't understand data, you never will be able to understand research. Okay, so
Okay,
understanding
okay.
of that, and that's why you see the entire world is now moving towards data analytics, big data analytics, artificial intelligence, machine learning. Okay, so data, understanding of data is very critical for research methodology and to understand research, right?
Yes, sir.
Okay, thank you so much. Okay.
Thank you, sir. Okay,
Thank you
Okay.
so much. Thank you.
Okay. So take care. Good night.
Good night.
okay, sir.
Good
Good
night.
night.
Okay. See you.
Good night, sir.